So here at Engaged Care Talent, we absolutely love chatting with people who are passionate about changing health and social care for the better. And that's why I'm particularly happy to have spoken to Raf. Raf is at Cygnet and he's very much at the centre of looking at co-production and how that can improve the way that care is delivered. Raf's got an extremely inspiring story that very much is the reason why he does what he does today and why he is so passionate about changing things for the better. Hey Raf, how you doing?
Good, thanks. How are you, Chris? Long
Oh,
time.
super happy to have you here. Yeah, really appreciate it. And we're here. Good shout out to the Dream Factory team and their studios.
It's amazing,
Lovely
isn't it?
place. Just on Shoreditch.
I love the chill hop coming in.
Yeah, it's great, isn't it? Just great vibes, definitely. And I really appreciate you taking the time out. Because I know you're busy, but I wanted to get you on the podcast because we've known each other kind of directly and indirectly for probably like maybe 2 years now, I think. And I think it's
been a while, hasn't it?
It has. It's amazing how quickly it goes, but it's like there's such a fascinating, story I think that you have to tell, and not to say not going down there has to be an epic tale of of your career journey. It's not that, but I think there's things you've done and things you've achieved and things you've gone through, which I think is just really fascinating to talk about. More importantly, I think stuff that other people can take and use that to do whatever they want to. But I think it's definitely valuable. We'll talk about valuable content, and this is valuable, I think. So I really value the time that you're putting into this, definitely.
Thank you for giving the platform to be able to share experiences, and particularly lived experience, because I think lived experience is the way to really share the way forward and how we can learn from the past.
Yeah, 100%. So, should we start? Tell us a bit about yourself.
Let's go. Raf. So, my name's Raf, as you know, Chris, and I'm the Expert by Experience lead for Cygnet. Expert by Experience is someone who has lived experience of using or caring for someone who has used health and or social care services. In my case, I've used a variety of different mental health services growing up since quite a young age. A big part of it was kind of not really going to school and stuff like that because of the mental health element, or getting kicked out, or just not being able to go because of mental state. And I've been in that kind of CAM services, which is child and adolescent mental health services, young offenders getting into trouble, all sorts, smoking weed, which was very conducive to my mental health at the time. Just a mad world of kind of like paranoia and all sorts, and ultimately ended up in secure mental health services for quite a few years actually, and seeing a lot of like the same faces, of where I was growing up really, and the same people that I'd seen, like the pupil referral units, so the same people that were getting kicked out of school, the same people in the mental health services, and unfortunately there was a lot of similar features in terms of particularly people from ethnic minority backgrounds, people from deprived backgrounds, and seeing some of those features, and it was just a bit of a moment in terms of being able to see this cycle develop and what felt to be like a lot of oppression from a system of containment and confinement. You have lots of people who are kind of in a school environment, for example, that may struggle to keep up with the rest of the class or may struggle with their mental health. And what we do is, we kick them out of school and put them in a pupil referral unit, that place that you go to where you get kicked out of school. And, it's never, in my opinion, a good idea to, put lots of different people with lots of different struggles together, because we're just moving the issue away from mainstream school. I mean, just putting, in essence, shelving people, away. And I felt that was kind of the same in terms of my experiences of mental health, because I feel like sometimes as a society, we do that same concept, but with people struggling with mental health in the community, and then hospitals and institutions and young offenders and prisons. And the rates and the disparities and the data kind of speaks for itself. And as you know, through my experiences of being in hospital, I really struggled with some of the restrictions and like some of the points of conflict and some of the rules and so on. And naturally, a lot of the kind of demographic that I'm speaking to you about would naturally have kind of quite a rebellious nature, right?
Yeah.
Kind of the people that would get in trouble at school or end up in these kind of environments. So, you're watching a film for 2 hours, there's 10 minutes left, but it's midnight, and there's a rule that the TVs have to go off. What's going to happen? Stuff like that. So I used to challenge those kind of things, but, instead of, in the early days, you end up in a seclusion room, if you start getting a bit too rowdy. But over time, I really learned to develop the skill of trying to challenge through logic and just explaining, what's the point? Can you really not be a little bit more flexible and give people 10 minutes or whatever it may be to avoid an incident from happening here, or to avoid upsetting people who are actively unwell, or, creating an environment that feels very oppressive. And through that, actually developed a relationship with the Care Quality Commission, who are the regulator for health and social care. And it was suggested that when I'm discharged, I should become an expert by experience.
Okay.
And when I was discharged, I started kind of doing inspections. I'd already started the process whilst I was still in hospital, actually. Because being in hospitals, like getting discharged is a very complicated process. You're not just suddenly just let out of hospital, right? There's like a process where you kind of start going on something called home leave and community leave and all these things. And then for example, I was on home leave for quite a long period, so I basically technically started employment whilst I was still in hospital, depending on what way you want to look at it. Of while I was at home. And it was really fascinating, really, because I was just able to travel all over the country and see what good looks like and see what not so good looks like, and compare it to my own experiences, speak to people from a lived experience perspective as part of an inspection team, to go into services and in essence sit down with service users and speak to family carers and staff, and find out what their experiences are to help advise the inspector and inspection team on what the sentiment is, what people's experiences are, which then has an impact on the regulatory rating of those services. I've done quite a lot, and off the back of that, I started working at Cygnet as the expert by experience lead. After kind of seeing a lot of their services and kind of just seeing an opportunity to co-produce culture together, and I've been there for some time now, and that's how we come across in it.
Yeah, absolutely. And I think I remember one of the first times I saw you was the video Raf's story, which is on. Put a link in, and we'll probably show some of it while we're talking here.
Cool.
And I think it's it's great. It shows that the journey that you've done in a nice concise way, but it's it's there's things that for me, I looked at it as like, look, there's clearly things that Raf have done to get him to where he's gone now, very kind of conscious and passionate things that he's done, and like that thing about spending time with or befriending that person at the Care Quality Commission. That's you didn't have to do that. A lot of people wouldn't have thought to be kind of stepping out and put themselves out there. But why did you feel you had to do that? Because clearly you were doing things, as a service user.
Yeah.
That person then thought, oh, this guy Raf has got something he can share with lots of people.
I'd never heard of them before. Like a lot of people maybe not have heard of, like, you kind of hear of Ofsted, right? because of like schools, and everyone wants to go to the best school and stuff like that, and parents have got their children's best interests at heart naturally. So you kind of know about Ofsted more than the Care Quality Commission, but they're very similar. I mean, they even had the same kind of ratings, outstanding, requires improvement, inadequate, good. But I think I kind of saw some posters around, and I kind of heard some inklings. But what's really interesting about everything that happened in mental health services, and even to this day, and what a lot of people talk about in terms of psychiatry and mental health recovery, a lot of it's about power. About the power, the very complex power dynamics, both within society but within these environments, and the power clinicians have over service users and patients. And I was really able to experience that, someone really having power. Imagine someone being able to tell you how many minutes you can go outside for in a day. The power complexities around that, and how I have to perhaps appease you and reassure you to let me out for 15 minutes. Those things are very complex. Yeah. So I saw at the same time that when the inspection teams come around, the staff would panic. Managers that you haven't seen in a long time start coming down to the wards, trying to appease the service users.
Okay. Yeah.
And I found that very interesting, because it's anyone working in mental health or health and social care services would understand what I'm talking about right now. You have an inspection come in, sometimes they're unannounced, sometimes they're announced. If you know that the CQC are coming in advance, or they just turn up and word gets around, you start clearing up, you start putting posters up, all sorts of things. And that was very interesting for me, because I saw the power dynamic there. Yeah. And of course, being in the sector now, you understand that regulation is very much the carrot and the stick. No one wants an inadequate rating, right? It affects everything from recruitment to experience to stature. Do staff want to go and work at an inadequate trust? Are carers reassured by their relatives being in an inadequate trust? In the independent sector, you may not even get referrals. In the private sector, you might not even get referrals if you're inadequate, as a result of commissioners, funders not wanting to send anyone to you off the back of that. They may even be in the contracts. So, but on the other hand, you of course want to be outstanding, right? Because everyone wants to be somewhere that's outstanding. You get lots of referrals if it's the independent sector. It's something you can be really proud of as an NHS trust, as a leader and, a shining light for what health and social care should look like. And, we have the stamp of approval from our regulators. So really understanding those dynamics really helped me appreciate the importance of the Care Quality Commission, and also the opportunity to be a part of, a system of change. So a lot of my complaints actually used to just be directed to the CQC,
okay.
And to the inspectors, and being able to really articulate it as well in a lived experience context. So I think the CQC play a massive role, and I was able to see that really, and I saw the impact that they had. You put a complaint in a mental health service, you might never hear anything back, or you might get a letter back saying we'll discuss in 25 working days and blah 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 blah. On the other hand, you make a complaint to the CQC, it might get sorted out then and there.
Yeah.
And that's not their official stance, right? Then they won't come out and say that. But sometimes inspectors might go and want to corroborate any information that you give them. So if I say to you as an inspector, this is happening on the ward, they may want to go and corroborate that with a member of staff. That attempt to corroborate starts to make management or the staff panic and want to address this issue. Oh, the inspector's asking me this, and their tone, and so on. I think we need to change this policy, or we need to change this rule, or we need to, we need to unlock that door, or we need to make this less restrictive. So it has an instant effect without them even making that direction. And can you see that how important that power is? The inspectors can change things in a service without even telling them to change it, but just by having a conversation. It's like me coming in here, Chris, and saying to you, I spoke to the lovely chap who made us coffee when we come in here. And
Coffee.
It is good coffee. And, he's told me that microphone over there is a bit bent. Why is that? Do you get where I'm coming from? Yeah. It's stuff like that where that happens in those environments that create change, very subtle, very, the complex power dynamics. And being part of that was great. I've done over 150 inspections with the Care Quality Commission now. Not only mental health services, but I've been part of like thematic reviews, seeing what this looks like from schools all the way to mental health services, community services. The thematic reviews were very interesting in terms of looking at the pathways and the entire system. But also like GPs, acute hospitals. What does mental health look like in those kind of environments? Primary medical services, acute services. So it was a massive journey for me, getting that experience, especially understanding the geographical variations in how provision is delivered. Do you know what I mean? Because what the challenges and factors in London are quite different to rural areas, right?
Yeah, makes sense. Yeah.
And even in urban areas, London to Manchester to Birmingham, the landscapes can look quite different. The challenges can be quite different. Even how, interestingly, the inspectors themselves interpret regulation.
Yeah.
Or how the NHS deliver services, despite there being an overarching, aims and, an overarching framework. When you're dealing with things at mass or, countrywide, there can be regional interpretations. And again, that comes back down to the power, because, that could even be down to how, a regional lead within an organization or the regional head of inspections, for example, interprets things, and that relays down to their individual team, which is why the North may do things a little bit differently to the South, or why the South may come and, hammer you for your not recording your fridge temperatures properly. Whereas the North, they're not really too bothered on that. I'm just giving an example. They're not saying that happens. So that was a real like growth thing for me, because experiencing all of that stuff was probably like the real start of my career, and really understanding not only what it feels like to be a service user, but also understanding power, being part of it, and having that shift from not being powerless to having power.
It's quite liberating, isn't it? And I think also there's lots to take from that, definitely. In particular, I think it's this thing about the passion you have for actually seeing change happen, and something quicker than maybe it usually happens. And you decided to go, actually, I'm going to just go directly to the CQC rep, and there's something that made you do that. Other people wouldn't. They just go, well, I'll go through the usual process. And there's that thing about wanting to get things done quickly, knowing actually you actually have control over that, more control than you think. And I think that's something that a lot of people can.
My challenge to that is, Chris, what is the usual process?
Yeah.
Because when you're at rock bottom and you're on a secure mental health service as an inpatient, what is the usual process? The usual process normally is getting a place, some sort of supported accommodation in the community, and then maybe getting a college placement, and if you're lucky, and kind of just living off benefits. That's what happens in a lot of cases, and it's very sad and unfortunate. I really wanted to go to university when I was in services, and I remember going to my doctor and saying, look, I want to go to uni. And he was kind of said to me, Raf, I think you should just do some classes first, and think about GCSEs at some point. And that's very that really damaged my confidence, and my ability to want to even go to university. But it's like what you said. Sometimes you just have to go direct to the source, right? So I just went direct to the university upon suggestion of a colleague once I started at Cygnet, and said, look, these are the reasons why I couldn't go to school. I was in mental health services and so on. And, I was able to actually get onto a master's program studying mental health recovery and social inclusion. And I was able to graduate. And, that's without any A-levels or an undergrad or any GCSEs. Because of, the whole element of not only the lived experience, but the professional experience and being able to explain these things. And, I think one of the benefits that we're seeing now as part of this paradigm shift, and partly driven by policy, i.e. reasonable adjustments coming out of the Equalities Act, but also like a very value-based and social impact element that we're seeing, partly driven by the whole fascination around ESG. But basically what I'm getting at is that there's flexibility these days in things. They're not so, people understand if you might not have traditional qualifications. People might understand if you have a troubled past, or if you've been in services or whatever it may be. And I remember I used to go to like war protests when I was younger. And I used to say to my parents, I don't want to go. There's 100,000 people going to protest the war in Iraq. I want to stay in bed for a little bit. I don't have to go to the referral unit today or whatever it was. And I remember like my dad actually telling me something that stuck with me for a long time. He said, if everyone thought like that, there wouldn't be anybody at the protests.
Yeah, exactly.
And nobody challenging our foreign policy. So that's something that's kind of really stuck with me. So I feel that we should challenge things. We should, go with things. It can be complicated. It can be difficult. But you, whoever you are, have the power within you to change policy. Yeah. It can be an email. It can be going to see your MP. It can be making a complaint. It can be whatever it may be. Because just off the back of that, people with disabilities up and down the country now have a safeguard in place, or now have a great pressure taken off their shoulders. Of if they're on a university course, they don't have to worry about payments and getting kicked off and all of this stuff, because those payments can be made directly to the university now. And it's a small thing, but it's the accumulation of those small things which create more inclusive environments and safeguard people from ending up back in services. There's a massive cost benefit as well for society, I would argue, because part of the business case around this is, even if this stops one person from ending up back in a mental health service, from relapsing off this whole, situation of, spunking the student loan and then getting kicked off a course and then ending up back in services, if we can just stop one person from doing that, that's a life basically saved. Yeah. But also, even on the cost to the public purse. I mean, do you know how much it costs to keep someone in an inpatient service for a year?
I can only imagine. It's yeah.
It goes back. We weren't even going to.
It goes back to what you're saying about the kind of prevention rather than cure. Is there's things you can do. It just takes a bit of thought to understand that if you do something that's not clearly at the first point directly impacting something, it does impact it eventually. I think I love what you say in particular about ultimately this is about you going, look, I think there's something I can change, and I think when people think, if I'm going to change something, maybe I have to have all the answers. I have to come to somebody saying, I've got all the answers. But to actually go, well, I know I need to do something about it. I am then going to talk to the right people to be able to do that. So there's that nice balance, I think, between having that passion and determination to make change, but balancing it with empathy with other people and actually understanding that they can bring something to help ultimately what you want to achieve. Whereas there'll be, people who go, right, I'm determined to make something happen by hook or by crook, it will happen. And if anyone falls by the wayside, then
The Apprentice, for example, was on last night. I missed it. I fell asleep on the sofa, but that is a classic thing, and not that we can talk about the Apprentice loads, the Apprentice loads, but there's that thing about, by any means necessary, I am the winner. And that's still an attitude, I think. Even you could argue that the Apprentice is actually, I've even heard it actually, people who are assessing people going into early careers in assessment centres actually seeing the apprentice effect of people kind of just bulldozing their way through things. And actually, you need to have that passion to drive things through, but also you need to have that empathy and appreciation for other people, because otherwise you won't do it.
I think
you won't get it done.
Yeah, you're absolutely right. And the key word is reasonable, right? I think, we talk a lot about reasonable adjustments. Yeah, and that's adjustments that are expected to be made for people with protected characteristics. But I also advocate to people with lived experience, for example, that we also have to be reasonable in our expectations. Yeah. That whole thing around reducing restricted practices, some of those examples that I gave you around the TV going off at midnight, or, not being able to have coffee to promote sleep hygiene within mental health services after a certain time. An average cup of coffee has 50 milligrams of caffeine. An average cup of tea has 45. So are we really allowing people to drink as much tea as they want, but not coffee? Over a 5 milligram difference of thing. So a lot of the rules aren't based in logic. And when you actually sit down with those people making those rules, or, the ward managers or the hospital managers or whoever it may be, we've seen a massive culture change over time, because you hear that lived experience piece, but also there's no logic in this, even from like a scientific level. It starts to break down those barriers. But at the same time, sometimes people argue, why do we have to have meals at a set time? And that's true in many respects. But at the same time, we also have to be reasonable, and there also has to be compromise. So I often give the example when I'm training staff, is that a good way to test yourself out and test your service out is it as good as an aeroplane flight? Is it as good as a flight? And, people often think I'm relapsing for a moment when I say that, but let me elaborate.
That's interesting.
Right, in this country, we have something called the HSIB, the Healthcare Safety Investigation Branch.
Right.
When I say Healthcare Safety Investigation Branch to you, this is an organisation that does quite complex investigations and goes in, and it's based on a kind of non-blame culture. That their leadership and the concept actually stems from the aircraft accident investigation division and community. So I think their CEO, not sure if he's still there now, but was actually a chap from the aircraft investigations industry. But he's leading up the Healthcare Safety Investigation Branch. Why? Because they do a really good job when things go wrong in terms of learning lessons. There's a plane crash. Imagine how many committees are happening. Imagine how many policies are changing. Imagine how many new processes and systems are in place and embedded to ensure that doesn't happen again. That's what we should be doing in health and social care. When something goes wrong, does it make sense that it happens again the next week in another service up the road? So there's a massive piece of that. So when I'm training staff, not so much about the investigations or lessons learned side, but what I say is, look, and I also say this to service users as well, cabin staff are expected to treat people with, be very polite and compassionate and understanding to people, and deliver really good customer service. Passengers are also expected to follow a reasonable amount of rules. You can go, of course you can go to the bathroom, of course you can eat, but there's set times. But you can press that little button and have a word and say, can I have a little snack or a drink right now, please? Because, I just got on and thing. And adjustments can be made, and they're reasonable, and it's about that conversation between you and that cabin crew. You can have your headphones on and watch TV, except for when the safety introduction thing is happening, right? So, there are, it's all about flexibility, about reasonable adjustments, and about compromise, and about, you can watch a film for the whole flight if you want to. We've got different activities for you to do. You've got this screen in front of you. This is all dependent on who you fly with, by the way. But I'm saying, the point is that when it comes to elements such as that safety introduction, or when we're, can you put your phone on airplane mode, please? There's reasons behind these things, and they're real justified reasons as to why. If they can be justified, they're around safety or they're around well-being, surely as service users as well, and as family carers, we should also understand that, and understand that, we have to also be reasonable. We also have to make compromises. And I think that's really important, because that's a balance, isn't it? That's fair, right? We can't just go into mental health services and say, this is how it should be. We don't want any psychiatrists. We don't want your medication. We don't want these things. I think there's room for everything. And it goes back to what you were saying about that element of that co-production, and working together, but as equals, and just understanding that we have an equal voice.
So a lot of what you've been talking about, this thing about surrounding yourself with the right people.
Yeah.
Coupled with your passion to drive to get something done, is a great combination. So how do you do that? Because as you said, people who can just go back to their way of life and they'll, and end up just the same thing happening, and that can apply to all sorts of life situations there. So how do you, I suppose, basically how have you kind of surrounded yourself with the right people? Because working at Cygnet Health Care, you are surrounded by lots of people who are extremely passionate at what they do, but also have that equal interest to make change. So how'd you get to that situation where you're surrounded by those people who actually, Raf, you won awards, you're talking to the board, and from where you were when you were a teenager to where you are now, it's just awesome. So
no, I appreciate
how'd you do that?
Yeah, I feel like you've hit the nail on the head already in terms of the employment itself.
Right,
because I think people don't fully comprehend how important employment is and how important employers are. We're talking about power. I mean, the biggest power, the biggest drivers for change, I would say, are probably employers. Because if you was to take a shot on someone, or to be able to give someone an opportunity, that could change their entire life. Because employment is more just about a job and salary. Of course, financial security is great. Being able to move and to a better environment or have a better quality of life is great. But actually, we're also talking about a new support network.
Yeah.
We're talking about new friends. We're talking about colleagues and meaningful interactions. Even I met you through work.
Yeah, it's true.
Yeah?
Very true. Yeah.
And I feel like this is kind of therapeutic, maybe for the both of us.
It's good
right now.
Absolutely, this is brilliant. Yeah.
We said as a joke earlier. We said podcast therapy.
Yeah, exactly.
We need to trademark that, by the way,
100%.
before someone tries to nick that from us. But my point is that being in an environment where you can meet different people, we're different, and a lot of the time we're surrounded by people that have had very much the same experiences as us. I have friends now that are psychiatrists, that are nurses, that are people like yourself. I consider you a friend, and hearing your journey about where you started, where you are now, and even being married and having 3 children. Being a lot of people, my age haven't even got to that stage yet. Do you know what I mean? So you get inspired by new ideas, and you just meet new different people, and it changes your views and helps you mature as part of that process.
Yeah.
The problem is, if you're only surrounded by people from your area who do the same things as you, especially if they're negative, it only leads to this cycle, right?
How do you do that though? If you've got, people are, so there are various scenarios, aren't there? But it could be someone who feels they're surrounded by the wrong people. They're friends when they're growing up. They're still with them, and they're bad things that come from that, or even just negative attitudes that come with that, which can hinder somebody, or even, being in an organisation, you've maybe been there, and just there's something not quite right, And so, what would you do to actually to get yourself amongst the right people? Because if you're, I suppose, by the very nature of spending time with people that are different to you and have different viewpoints, you could argue that it's more difficult to find those people.
Yeah.
How do you go about doing that?
I think changing the environment is the most important thing. It may not necessarily be a career change. A lot of people obviously naturally float within their same career, right? Within their same career pathway or their circle of competencies. So whether you're currently in a job and it's affecting your well-being, or you haven't got a job and your well-being's being affected, I think a big part of it is not even so much about what your interests are or what your circle of competency is, but more just about the environment, because you've hit the nail on the head as well. Some people are very unhappy, or things can go very wrong whilst they're in a job, right? So this isn't all happy days. And it's about what you do. And I would say a big part of it is around values aligning. A big part of it is about well-being. Do you have support? Some organizations have better support structures than others. Some organizations have better occupational health than others. And some organizations just have a better setup and structure. I mean, I'm supporting someone at the moment who works for quite a big organization, and you would think from the outside, oh, this organization must be great and must be supporting you amazingly. But actually, most of it's remote working. Yeah. And the person feels very isolated and very depressed as a result, and not supported. And when trying to approach the employer, they just kind of offered this, like a hotline to call, which is very similar to the Samaritans. And the Samaritans do a great job. But I mean, some people may require a little bit more support than that. And, they're now having to kind of seek kind of support from the NHS and so on. So, I think it's about changing environment, about being somewhere where you have the right support, and about having the ability to open up to colleagues or people that may give you an opportunity if you don't have one already, because then they may be able to provide that opportunity for you, which aids in that changing environment. Yeah. So regardless of whether you are employed or not, if you are struggling, it's about changing that environment and about feeling open to trust about it. And a lot of the campaigning and stuff that I'm focused on, and my own experiences in my own journey, has been around the experience of ethnic minorities. Because there's a fundamental lack of trust, Chris, and not a lot of people speak about it openly, but a lot of people from ethnic minority backgrounds have been told since we're very, very young. Very young. I mean, I remember maybe 3 or 4 years old. Be careful about Chris. Yeah. Be careful what you tell Chris. Yeah. Don't trust them. Remember what they did to us. Stuff like that. People have grown up in those environments, man. Most ethnic minorities that I know, which is probably the majority of my friends, have experienced the same things, despite us being from different parts of the world. Yeah. How crazy is that? Some of us might share faith, so we might be Muslim. Like there's a guy from Somalia I was talking to yesterday. He said, "Yeah, my parents told me the same thing." A guy from Jamaica, a guy from Iraq. But these will all be for different reasons. Part of that would be, you've got Jamaica and the Windrush generation, and that individual's parents and grandparents' experiences. You've got my experiences in terms of French colonialism in Algeria, and what my grandparents went through. You've got Iraq, and that's more political and around the war. But when you actually look at all of these things, it's been embedded into us psychologically, and I call it colonial trauma. Okay. Yeah. Because it's weird to think about it, but how did my grandparents and great-grandparents' experiences ripple down to my parents and everything that they told my parents when they were young, change their mentality and lead on to what I was told when I was younger? Because it was very difficult for me, like, to be told that every day, and then go to school and like trust the teacher.
Yeah.
Or trust a GP, particularly when you need support as well, right? Because when you need support, it's about opening up and trusting people and talking to people. A lot of people from ethnic minority backgrounds were told these things from very young ages, and I said in a post that in some ways, like our relatives' pain and suffering lives on within us, but we have to break the cycle of the trauma. And I made a commitment that if I, like, God willing, when I have children, that like I'm never gonna teach them not to trust the white man or the English people or something like that, because we live in a different day and age now. There's rights, there's laws, like racism isn't what it is. Like what our parents and grandparents and great grandparents experienced in colonial countries or war zones, or even in this country, a lot of it would be based on recent discrimination, and even people still feel discrimination to this day. But my point is that my great grandparents, their experiences of discrimination was quite different. They were really in the thick of it. Like, we're not talking about whether I get a job or not. Like, their one was like, am I going to live or not? Like, I can't even go to that area in my own country because some other guy from another country is telling me that I can't do it.
Serious stuff, isn't it?
Yeah, about how you can dress and so on. And that's super important to understand that, because we often talk about what are the disparities and why can't we engage with people, and then we get labeled as being hard to reach. I hope I'm not hard to reach, Chris. You got my number.
Yeah, exactly.
Yeah, we're on LinkedIn with each other. Yeah,
exactly.
so like we're not hard to reach. It's just there's an element of distrust there, and it's really important that we have that conversation about it. It's a difficult conversation to have. It's kind of, there's a level of embarrassment and uncomfortability in it to tell you that this is what my parents used to tell me when I was younger. This is what, but it's the reality.
Understandable, and I think it's like, so it's really interesting because I think not what it boils down to, because that's not trying to simplify it, but it's like, I think human beings, we are here because of the communities we've built, the tribes that we built, the networks we built, that we are very social, beings, and that's why we are, here on this planet right now, and survived and being here on this planet right now. I think it's this thing about, it's just natural, not natural, easy for people to put these kind of rings around each other, these barriers around each other, because it's safe to do it, understandably, in various situations where safety is really important, as you said, in terms of your grandparents, for example. But I think also is that thing about that safety in being amongst groups of people that safety in not asking the question I don't know, and being open to listen to someone else's experiences. I think that kind of stuff does kind of, oh goodness, break down the barriers. It's relevant. It's a relevant phrase, break down those barriers, because then it goes back to the thing about surrounding yourself by the right people. If you've got that kind of passion to make some change, but also realise it's not just down to you to do it, and appreciate other people's points of view, then actually you learn things, you get things done more, rather than just having that kind of narrow-minded view that, yes, I'm determined and that's good, but if I want to do it myself, there's a chance you're not going to achieve it. So not achieve it in the right way.
Yeah.
No.
I was going to say, like, in a career context, it's been so interesting just hearing that from you, Chris, because, like, I just had a moment when you were talking where, like, with this whole conversation that we've been having and reflecting on the career and the journey, like, I think a massive piece of this is it's been a learning exercise, and we're continuing to learn. and share together. And a big part of it for me has been through the lived experience element and the career, but also a lot of the issues that I had experienced when I was younger and societal issues which I just never really understood or didn't even know were there. Been able to kind of start to understand a little bit more. And I don't want to say that, I figured it out. Yeah.
No,
Otherwise,
you never do
yeah,
you? Jeez.
maybe we'd have a solution if we did.
Yeah.
But I just start to like understand a little bit more about like, why these things are. And I just think to myself, like, maybe if I wasn't told not to, trust people that were not minorities my whole life, maybe I would have opened up to the counsellor a little bit more.
Yeah, okay, yeah.
Or spoken to the psychologist or whatever it may have been. I would have engaged with a little bit more. So there's a level of like accountability that like our we need to take on board as a community as well. I think that's like super important because a lot of people that feel disenfranchised within the workforce, as you know, are people from ethnic minority backgrounds, particularly in the health and social care. Because, we've got a massive international workforce. We've got a massive diverse workforce. We do a lot of international recruitment. But unfortunately, a lot of the time, that's not represented on a strategic level or on a board level. And, we've done a lot of work, for example, around, diversity, equality, diversity and inclusion, and multicultural networks across the NHS, across the independent sector, including like within Cygnet and stuff. And that paradigm shift starting to happen, and you're starting to see that happen. So I feel Rome wasn't built overnight, as they say, and it's just beautiful to be like seeing the change happen. So whether it's the draconian days of mental health asylums, whether it's real oppression and discrimination, those were things of the past, and we see remnants of it today. A lot of people argue, well, a lot of those mental health hospitals are still kind of like asylums. Maybe they don't have 500 beds, but they still got 50, and the practices and cultures are the same. But the point is that they're definitely a step in the right direction. We've moved away from a lot of those draconian practices. And the same way in terms of people's experiences around being ethnic minorities. And the reason why it's important to both distinguish and connect those things together is because some people have multiple disadvantage.
Yeah.
Like being a kind of young Muslim forensic mental health patient. I both like have a chip on my shoulder about being a minority and for having a disability. I feel like kind of disadvantaged on two parts. But at the same time, there's a level of gratefulness as well that I'm now part of the change and part of seeing the change happen. And a lot of it is reflective. So, I feel like it's really positive. What's happening, that the conversation's happening. There's a massive school of thought, Chris, around how loneliness is actually around how evolution has helped us stay alive. Because lonely, our ancestors used to roll in packs, right? Because your chances of survival were very low if you were alone.
Yeah.
Right? And it's our ability to work together and be a community that has kept us alive for so long.
Yeah.
Someone's going to get the wood to get the fire. Someone's going to go hunting. It's impossible for one person to do all of that stuff. Your chances of survival, when you got dinosaurs running around or whatever, trying to eat you, and whilst you're trying to get food, trying to get wood, trying to stay warm, like it's our ability to work together. So loneliness, according to a lot of researchers, is like a evolutionary feeling that we have, almost like a warning system, an alarm system, to let us know when we're behaving or about to lose that social connectedness. So loneliness is in essence a way that our mind is telling us, listen, you know, you need people right now, you know, and you're at the risk of kind of losing people and so on. And that's a really interesting thought to have, because sometimes you can be lonely in the workplace. And why is that? And a lot of people felt that during the pandemic as well, didn't they? With the whole remote working stuff and
100%.
you know, but I mean, like, if you look at how much Zoom is part of our daily lives now, how much like Teams and stuff are part of our daily lives, just in a very short space of time.
It's amazing.
Even though we are in this country on the other side of kind of you know, social isolation restrictions and stuff, you know, it's really phenomenal. But you know what? There's a lesson learned in that, though. It goes to show that we can change quite quickly if we want to.
Oh my God.
We can change our ways and our working practices. Organizations can be flexible.
Exactly.
Because imagine going to a massive company overnight and saying you have to close your offices.
Could you implement a remote working policy, please? It'll take them 10 years.
Yeah, do you know what I mean? Yeah, like so that it's nuts when you think about it, because you've went to these massive institutions. The whole, like, we're not too far from Canary Wharf right now. Ghost town. You know, like, so like, if you can actually go to these big banks, these big companies, and actually say, you know, you were able to do something amazing during the pandemic. I mean, overnight, you was able to keep your company afloat over a significant period of time, doing working practices that you've never done before. I mean, if we can do that, then surely we can think about supporting people's well-being better.
It's just it's just like mind-blowing. You know, a lot of bad things obviously happened because of COVID. But like of anything, when, you know, society is faced with massive trauma like COVID, that instinct to survive kicks in, and what was deemed as luxury becomes necessity, and so many good things come from it. I think it's really exciting. And so there are things that companies can do to help employees, you know, to help develop their careers. You know, but what is it that, you know, going back to the thing about when we look back at the good things that have happened in our lives, it's when we've kind of grabbed hold of it and gone, I'm going to do it.
Yes.
So what kind of things can people who are listening doing? They might be in a job that they absolutely love, there's something not quite right, or they're they're not too sure where their career is going. They might be enjoying the day to day, but going, well, you know, what is the point in this? What kind of things can they do to themselves to make sure that they're kind of, I suppose, doing themselves justice and ultimately fulfilling themselves?
I think, like, one of the things that I've tried to do, and I appreciate this isn't something everyone can do, because, you know, some roles are quite rigid and you might not have as much flexibility. You know, I'm in a unique position because, you know, this is a role that I kind of created for myself within the organisation.
Albeit in a very, you'd say the mental health and social care sector has to have rigidity to it, and structure and framework. So you still manage to work yourself around that as well. That's correct, to be fair. And you know, my role is to represent the views of service users and people with lived experience and family carers at every level of the organisation. And you know, that involves, you know, sitting on meetings. It involves you know, going out to site and speaking to people, but it also involves doing new projects and innovative projects, right? And through that, you can have the opportunity to be able to bring things that are meaningful to you, that you enjoy doing, that are therapeutic, and bring them to the workplace, i.e. music and music to empower. You know, I love music. Music's also happens to be something a lot of our service users love. It's the oldest form of therapy for people experiencing mental health. And the longest running. And at the same time, you can deliver really good content through there as well that showcases the organisation. And this is what co-production is about. And this is very fulfilling for me as well, because the commercial team love it because it makes the organisation look good and, you know, get more referrals or whatever their agenda is. You know, the director of nursing may love it, and the medical director, because it's enhancing service user experience, right? And it's giving hope and confidence. Recruitment love it because
people see like a music video made in a hospital environment that looks amazing by service users and is so inspiring, and they use that as content to really showcase the organization and make people think, oh, that's a really good organization, I want to go and work there. I mean, so there's things that are reciprocal to everyone. Service users love it, I love it, it's so fulfilling to me, and of course I also get fulfillment from the fact that everyone else is fulfilled. You know, because this is something I love. Like, I love music, but I love that service users love music and they're building their confidence and pushing their stuff out there, ending up on BBC, all sorts, performing, you know, getting jobs in the community, in studios. I love that. And I also love that, you know, my fellow colleagues are able to use that in supporting their roles as well, if that makes sense. So I feel like if you enjoy something, think about incorporating that into your work in practice.
Yeah.
Because then it's going to come from the right place. And you're going to enjoy it and you're going to feel fulfilled. And hopefully others will be fulfilled from that as well, where you can find further fulfillment.
Yeah.
And there's something beautiful in that.
And it just grows and grows and grows from that, doesn't it? It's all feeds itself, doesn't it?
I think, like, whatever role you're in, it's about trying to innovate and push the barriers and try to do things differently and trying to embed something that you enjoy and something that other people would enjoy as well. And you know, a lot of the people that I work with that kind of lead on like national projects and have come up with amazing ideas, you know, aren't the people that you would expect. You know, a lot of staff have these kind of unofficial secondary roles, you know, like, hey, like, I'm an occupational therapist, but I'm also the recovery college lead. You know, I'm a nurse, but, you know, I bring my guitar in on the Saturdays and we have a music group. Yeah. That's not in that nurse's job title to do that. You know, that's not an expectation that you have to bring your guitar on a Saturday. But actually, that nurse that I know that does that actually explains that it helps her own well-being, helps her own fulfillment in terms of her role, but also helps the therapeutic nature of the ward and that relationship with the service users. Do you get where I'm coming from? Yeah. So I feel like a lot of the time, sometimes we can be, you know, very hooked onto, sometimes we are the robots. We go into roles being the robots. Do you get where I'm coming from? Because if you're just following the JD, the job description, if you're just following exactly what you're supposed to be doing to the T, are you really going to find fulfillment? It must be a really fun job for you to find fulfillment.
It's creatures of habit, aren't we? It's also a natural thing, which kind of grates with the natural instinct to want to discover new things. But I think habits can be, you know, can mean that we get used to doing things in a certain way and forget actually that we need to ask questions or put ourselves in places where we're not sure what the answer is going to be, but we do it anyway.
There's a, you know, like there was, I remember giving that example before and someone challenged me and said, oh yeah, Raf, you know, but, you know, what about an accountant or someone working in finance? There is a charity called Suited and Booted. Okay. They move around quite a lot, but they're probably near you because they float around a lot around this area. Suited Booted is a charity that's run by a lady called Dr. Maria Len. Okay. And they provide free suits and employment advice to vulnerable men.
Nice.
I remember going there for the first time to take a service user who wanted to get a job, and he got discharged. He was in the community, and I took a service user there. And most of the people that I met there were bankers.
Huh. Interesting.
And I always thought bankers were wankers. And then, you know, I'm meeting this guy from HSBC, this guy from Lloyd's, and this guy from, you know, so on and so forth. And I was just explaining like what they're doing here, and they said, you know, I come here on my lunch breaks to, you know, loan some of my time to the charity, to, you know, just have a few meetings with people, give them some tips on employment advice, You know, a lot of them have donated suits or go back to the office and get, you know, everyone's kind of suits that they've grown out of or whatever, and donate it to this charity. And then I thought that was super powerful, man. That was a big wake-up call for me. Because I was like, wait, so you come from Canary Wharf on your lunch break to come here and speak to, like, my peers? Like, I never knew this was happening. And when I had spoken to one of them quite deeply about it, explained how fulfilling it was for them, and like how it was almost like a way of, yes, partly giving back, but also a way of like dealing with such a boring job in their opinion. And that may have just been their specific role. I'm not generalizing the entire sector.
Yeah.
And
it goes back to the thing about someone being good at what they do, but not necessarily enjoying it and being fulfilled by it.
Yeah. But that's quite an innovative thing to do, right? So you might even be in a situation where there is that rigidity and you can't necessarily do something in your role, but it's about what you do during the day as well, maybe. What are you doing on your lunch break? Because if you are in the most boring job in the world, if you're doing something as fulfilling as changing people's lives in that 1 hour during your lunch, maybe that's all it will take.
So we talked about, surrounding yourself by the right people, and I think the natural way the mind goes is talking about, mentoring and finding, not necessarily having an official mentoring or mentoring scheme. I don't think it has to always be like that, but
sometimes it's just natural, right?
Yeah. Because what is kind of for you? Let's talk about the kind of the role of mentors in the kind of the growth of your career journey, I suppose, and the kind of the growth and progression of your career.
Like I feel like I come into this whole concept of lived experience and mental health during a bull run,
okay, yeah.
or like the first bull run, because I've just been gifted with some of the most amazing mentors there are probably around, and I definitely couldn't have been able to get this far without them or without their support, because there's a lady called Dr. Geraldine Strafty. She's like an OB or MB or whatever she was. She's been a psychiatrist for longer than I've been alive. Yeah. She's on like the board of South London and Maudsley NHS Trust. It was like national clinical director for mental health and all of these things. National professional advisor for the Care Quality Commission. Extremely experienced, very knowledgeable, and I remember bearing in mind the Care Quality Commission stuff that we talk about. That was my first ever job. Yeah. You have to really think about how that even sinks in, right? So that was my first ever even job period, right? So and everything I've ever known in the working career has been around regulation and around the CQC. So outside of that, my first ever actual thing or role in supporting or gig, should we say, was Dr. Geraldine Strafty asking to come and support. There was an NHS trust that she was tasked with, in essence, investigating and supporting. And, it was really big at the time. It was all on the news. It's probably not appropriate for me to say which one it was.
Yeah.
But it was a big one on the time. And, she'd kind of asked to come and just be part of the process from a lived experience perspective, and to help her think around how we can maybe work towards representing the views of the service users within that trust. And I thought, I'm just going to go and give a little bit of a talk, and I'm going to kind of probably be in a room in a hospital somewhere, and we'll be talking about it. Then I didn't recognise this address. I hadn't even really been to Central London that much, to be honest with you. And this is a key thing here as well, Chris, because this is the importance of mentors. They take you out of your environment, your comfort, your comfort zone. Like a lot of kids that I work with that grew up on council estates, I tell them that this is like an invisible prison, because you have museums 10 minutes down the road that you've never been to in your life, that people travel from China and from Australia and from Peru to come and see.
Yeah, it's true.
These are invisible barriers. And anyway, I turned up, and it was in the boardroom in Deloitte.
Okay, yeah. Deloitte.
I didn't even know what Deloitte was, yeah. But
He used to work client. Used to be his client.
yeah.
Been there a few times.
I never had even heard of them. We were in the boardroom of this place. I mean, you got some of the most senior people in mental health and social care in the country there, and you know, like they're asking me like my opinion and actually value my opinion, and like I was just really, because even after the experiences at the CQC, right, I still had a distrust around society. I looked at the CQC as just being like, these are the only people in society that understand what's happening, because they actually go out and speak to people, and they used to work in these environments, and they're quiet, like kind of like they understand, and they're here for the law. And I had quite a very narrow view about the rest of the sector. So actually having the opportunity to go and develop that relationship more and get some more experience on a strategic level, and then be supported by Geraldine in terms of understanding the dynamics of how to influence change. And we were talking about the reciprocal nature of some of the work that I do. A lot of that stemmed from there, because when we're trying to create change, create policy change, or we need people to be on board, and that involves compromise. When we're talking about co-production, it involves compromise, and we have to accept that sometimes things that we take to the table, it might not necessarily always be accepted in its entirety, because through that compromise and through those conversations, we may have to give and take a little bit. And Geraldine continued to kind of support me a lot with advice and guidance. Later suggested that I be part of, introduced me to Professor Sir Simon Wesley, who was instructed by Theresa May and the Department of Health and Social Care at the time to do an independent review of the Mental Health Act. And he asked me to be one of the 12 chairs of that. And I was specifically looking at the ethnic minority experience on that. And that was a mind-blowing moment for me, because I was kind of sitting down in this room thinking, wait, I've gone from a seclusion room to chairing a draft bill that's going to go through Parliament, basically, and really change this Mental Health Act. Do you get what I'm saying? So that was like a real moment for me. And on reflection, I don't think a lot of that would have been possible without the mentorship. Mentorship provides confidence, takes you out of your comfort zone. You have someone to turn to and trust. Amazing networking. I mean, mentors like the ones that I've had, for example, I've been around for a long time. And a lot of people's mentors would have been around for a long time and are experienced. And in many cases, that's why they would be your mentor in the first place. What does that mean? That means they also know lots of other people in that sector, in that circle of competency, that can also support you in various ways. And it's about, like you said, giving those skills and those tools to be able to go out and, do it on your own. And the reason why Geraldine has been such an important mentor for me is because, after I started working for Cygnet, for example, I found a new mentor in Mike, our chief operating officer at the time, who was amazingly supportive, for so many years, and really helped, change the culture of the organization and so on. And Mike meant a lot to me as well. But even many years on from I don't speak to Geraldine every single day, or even Mike every single day, but a lot of what they taught and the skills and the tools that were kind of taught to me still remain, and enabled me to kind of function a little bit kind of going out into the wild on your own for the first. I mean, mentorship's super important, and it goes down generationally as well. I feel like, I'm into a lot of people now as well, and a lot of the same stuff that I'm told that I tell people is what was kind of told to me.
Yeah.
So there's almost like a level of kind of sharing, you know, as well. And yeah, like I feel people underestimate mentoring, and there's a risk as well, Chris, because people think that it has to be this official thing, like, oh, go to this mentoring program or go. The best mentoring I've ever experienced is when it's very natural, because a lot of the time it's about relationships.
Yeah, exactly.
Not like you're going to meet this person, they're going to be your mentor. I don't think that really works, to be honest with you. I'm sure it does for a lot of people, and of course the kind of people that would want to be a mentor are probably quite decent people that can mentor. But I feel like mentoring is best like when it's done naturally. When you like meet someone in your sector, or even just like in life, even if it's another sector, who's been around on this earth a lot longer than you, but somehow you have this unshaken connection, you have this friendship, and you know, they take their time out to support you and give you advice and give you tools that you need to function independently and grow. Like a lot of the time that's just done kind of naturally and just happens. Sometimes you wouldn't even like necessarily identify someone as a mentor.
Yeah.
Do you get what I'm saying? But on reflection, you'll look back and be like, oh, that person like proper mentored me. Because, you know, when you're in the middle of something, it's difficult to realize it. Yeah. When you're in the middle of like a relationship with a mentor, you know, you don't even like kind of see it like that. I just kind of, you know, look at Mike as that, you know, Mike's my supporter kind of thing. Yeah, he's chief operating officer, but you know, he's the supporter. Or you know, Geraldine is just like my friend kind of thing, and you know, she's like just a cool psychiatrist. But on reflection, like these people were my mentors, and I don't think I could have done it without them.
Do you think you did it? So did you like so you didn't necessarily approach them? You're saying, "Can you be my mentor?" But it's just like, well, probably, you know.
I don't think I've ever had that. Yeah, I'd never had that conversation.
Yeah, lovely.
Never.
Actually, so that makes it more accessible by doing it that way, isn't it? So I think, yeah, as you say, people think that maybe mentorship is an official thing you have to do, but actually, if you just put yourself out there by asking questions, then that in itself enables you to identify some sort of rapport with somebody in terms of having the same kind of, you know, passion or beliefs, but also you naturally ask questions and then naturally going to want to answer them and share their advice with you. Yeah, nice shout outs as well. I think, yeah, it's I think back I think it's important for anyone to look back at their lives so far and go, you know, who has helped. I think that reflection is really, really important. So let's finish off with what's next. I mean, the journey has been pretty fantastic, and I say it's not a cliche to say inspiring for sure, because you know you've done so much, you know, and you really put yourself out there, and I think more people do that the better. But it's not just putting themselves out there and hoping for the best, but actually finding the right people to help you do what you want to do and do that together. So what's next? Do you think what's next in your journey?
You know, it's always a difficult one because like it's quite a niche role in it, Chris. Like, I mean, you know, there's no clear lines of kind of development or anything. My ultimate goal is to just continue to try to drive as much policy change as possible, and to work towards more recovery-orientated practices within services. Ideally with a shift to more community provision and more person-centered care, as opposed to what we were kind of talking about earlier in terms of, you know, how the institutions have now turned into basically just smaller institutions, where the culture and a lot of what happens is quite the same, but just named differently or carried out differently. I feel like there's a long journey to go, but it's just positive that we're already on the way. I really want to focus on helping staff feel comfortable to speak about their mental health. And we see good examples of this across Scandinavia, where half of the workforce have lived experience, for example. And to really embed lived experience and co-production at at every level of organizations. And the reason why I say this is because the deeper I've got into the whole co-production stuff and lived experience, listen, there's this whole thing about anti-psychiatry, and there's lived experience and recovery, and these people arguing in Twitter all day, like amongst ourselves. Like, I really don't have time for any of that. I mean, don't show me like how many likes you've got on Twitter. Like, show me how many policies you've changed. Show me how many lives you've changed. Do you get where I'm coming from?
Absolutely.
And like, the world is bigger than any one organization. The issues that affect people with disabilities, that affect people with mental health, are bigger than any one organization. And the policy change needs to really be driven on a national level. So like the example that we gave earlier around the kind of student finance, for example, that's not an issue that just affects one NHS trust or just Cygnet or just Priory. That's an issue that affects everybody across the country. So we can help people in hospital. We can, claim to help people recover and get back into the community and so on. But if they're just going to be faced by very national issues that perpetuate a system of just a cycle of going in and out of hospital and being stuck on benefits, and there's this whole rise in AI and how that's potentially going to impact people even more and discriminate against people more. Because I speak about my mental health publicly, like you said, right? You go for a mortgage application now.
I remember you talking about that before.
Yeah, there's a whole funny stuff around that.
I think what you said is really interesting, because it's like having that, ultimately, the direction you want to go in, driven by your kind of purpose and passion for what you do, and kind of how you get there kind of doesn't matter really, but it's so long as you've got that kind of, I don't know, North Star, so to speak, that is kind of guiding you. That's the most important thing, rather than saying I need to have every day or every month or every year of the next few years planned out, because that's putting too much pressure on it. But also I think it's you doing in 3 years' time what you think what it should be now, but you don't know because you haven't done it yet. So to have that kind of, that overall view on where one is going, I think is really important. But
we had train strikes on today, right?
we did have train strikes on today.
And so I had to drive over.
You did.
I took a few wrong turns, but the destination was the same.
Exactly. I think that's a perfect way to finish off. But really appreciate it, Raf. It's been a fantastic chat.
Thank you so much for everything that you do, and for giving us a voice, and for being so supportive as well.
Thank you, mate.